What is the history of lymphoma prognostic factors? Imagine trying to predict how a disease will progress years ago, with little more than guesswork. Over time, scientists and doctors began to develop ways to better understand and forecast outcomes for lymphoma patients. The journey started with simple observations and has evolved into complex, evidence-based models. A major breakthrough came in the early 1990s with the creation of the International Prognostic Index, or IPI, in 1993. This tool was developed through collaboration among many institutions across North America and Europe, analyzing large patient data sets to identify key risk factors. The IPI highlighted 5 main factors that influence prognosis. It over 60, advanced disease stage, more than 1 extranodal site of involvement, a performance status of 2 or higher on the Eastern Cooperative Oncology Group scale, and elevated lactate dehydrogenase levels. These factors were easy to measure and apply worldwide, even in resource-limited settings, making them a real game-changer. Age is a big factor because younger patients tend to respond better and tolerate treatments more easily. Older patients, especially those over 70, often face more health challenges that can affect outcomes. Performance status measures how well someone can carry out daily activities like walking or dressing. Patients who are more active and independent usually have better responses to treatment. The stage of lymphoma indicates how far the disease has spread, from stage 1, where it is localized, to stage 4, where it involves distant organs like the liver or bone marrow. Early-stage disease generally has a better outlook. Extranodal involvement means the lymphoma has spread beyond lymph nodes to other parts of the body, such as the skin or stomach. The more sites affected, the more difficult it is to treat successfully. Elevated lactate dehydrogenase levels are a sign of aggressive disease or a high tumor burden, which can worsen prognosis. Even with advances in understanding lymphoma at the molecular and cellular level, the IPI remains a reliable and widely used tool in clinical practice. It helps doctors classify patients into risk groups for treatment planning and prognosis estimation. Over the years, researchers have refined these prognostic models further. For example, they now use imaging techniques like PET scans to assess how well a patient is responding to initial therapy. This early metabolic response can help identify patients who might need more aggressive treatment or, conversely, those who could benefit from less intensive therapy. Additionally, specific models have been created for different lymphoma subtypes. For mantle cell lymphoma, the Mantle Cell International Prognostic Index helps stratify patients into risk categories based on factors like age, performance status, and blood work. Advances in treatment over recent decades have also improved survival rates, with 5-year survival increasing significantly in some subtypes. Researchers are also exploring how other health conditions, such as autoimmune diseases, influence prognosis. While autoimmune conditions are known risk factors for developing lymphoma, their impact on outcomes is more complex and varies depending on the subtype and individual health. All these developments have transformed how doctors approach lymphoma. By understanding and applying these prognostic factors, they can personalize treatment plans, improve outcomes, and give patients a clearer picture of what to expect. It's important to remember that each person is unique, and prognosis can vary widely. Always consult healthcare professionals for advice tailored to individual circumstances. The history of lymphoma prognostic factors shows a steady march toward more precise, personalized care, helping patients and doctors navigate this complex disease with greater confidence.